Good evening, guys. I have discussion C for you. Now, this one goes into palliative care and end of life care, but it looks at it from an angle of a student who is looking to get certified and such. So here we go. Professor Stephen Barkley, Professor Stephen Barkley's video, Palliative and End of Life Care Top Tips for Finals and Career Options, is a rich, student centered resource that blends clinical wisdom with practical exam strategies and career insights, drawing from the surrounding page content. This talk is part of the one and two med platforms commitment to demystifying complex medical topics and guiding students toward compassionate, informed practice. What the video offers. Professor Barkley, a seasoned GP and palliative care consultant, details years of experience into digestible format tailored for medical students as his dual role in clinical care and academia allows him to bridge textbook knowledge with bedside realities. Finals preparation. He provides high yield tips for tackling palliative care questions in medical school exams. These likely include how to structure answers around symptom control, communication, and ethical decision making. Key phrases and frameworks for discussing end of life scenarios, common pitfalls, and how to avoid vague and overly technical responses. Career pathways. Barkley outlines the diverse roles within palliative medicine, from hospital-based teams to community hospice work, and emphasizes the interdisciplinary nature of the field. He likely touches on training routines and subspecialties. The emotional rewards and challenges of working in end of life care, how palliative care intersects with geriatrics, oncology, and general practice. Clinical pearls. Expect nonsense advice on breaking bad news with empathy, managing complex symptoms like pain, breathlessness, and agitation. Navigating family dynamics and cultural considerations in end-of-life decisions. Interactive format. The video was streamed live and includes a chat display suggesting that students could ask questions in real time. This format fosters a sense of community and allows Barkley to respond to common concerns, misconceptions, and anxieties about working in emotionally intense settings. Broader educational contexts. One and Two Meds channel complements this with talk with resources on medical school interviews, life after diagnosis, and holistic care that emphasizes the emphasis on empathetic, culturally aware practice, a theme that resonates with Professor Barkley's approach. His talk likely encourages students to see palliative care not just as a specialty, but as a mindset, one that values dignity, autonomy, and presence. If you're exploring culturally responsive adaptations of palliative care, especially for marginalized or rural communities, I'd be happy to help map out Barkley's insights to those. Frameworks. His emphasis on communication ethics and interdisciplinary collaboration aligns beautifully with participatory equity and driven models. Okay, guys, I'm going to jump back on in a little bit for a D. I will see everybody in a bit for D. For now, Gator Wellness. Take care, folks.